Hello everyone. Today we will learn about hemolytic diseases of the newborn. Where mother is Rh negative and fetus is Rh positive, then it causes Rh incompatibility and leads to hemolytic disease of the newborn. Effects of Rh incompatibility on mother. In mother, there is no evidence of any abnormality. She develops anti-D, that is a form of antibody immunoglobulin G, in response to Rh positive cell, Rh positive RBC of fetus. She forms this antibody in her body, and it is not harmful for mother, but it is harmful for the fetus. The damage or hemolytic disease of the newborn is of different types, different grades. Number one is mild, that is known as congenital anemia of newborn, and second is erythroblastosis fetalis, and third is Hydrops fetalis. Mild congenital anemia of newborn, moderate is Erythroblastosis fetalis, and severe Hydrops fetalis. Hydrops fetalis, fetus will not survive. Fetus will die in the uterus, or it may die outside. Just after birth, it will die. It is not compatible with life. Pathophysiological explanation is when Rh positive fetus is in her womb, mother is Rh negative and fetus is Rh positive. During delivery, there is mixing of feto-maternal blood. Feto-maternal hemorrhage occurs, and in that case, some amount of fetal blood enters into maternal circulation, and that will lead to formation of anti-D antibody. During first childbirth, little amount of fetal RBC enters into maternal circulation, and it causes sensitization of the mother. Mother becomes sensitized. She starts forming anti-D, and before that antibody is formed, first fetus is delivered. Therefore, first is free from any sign and symptom. During second pregnancy, maternal anti-D enters into fetal circulation, and that will destroy Rh positive RBC. But as amount of anti-D is very less, the hemolysis or destruction of RBC is also less. Therefore, it will cause mild type of hemolytic disease of newborn, that is congenital anemia of newborn. Second is erythroblastosis fetalis. In case of second delivery, what happens? More number of Rh positive fetal blood enters into circulation, and mother forms more amount of anti-D. Therefore, during third pregnancy, large amount of anti-D enters into the fetal circulation and rapidly destroys fetal RBC, and this leads to severe anemia, and to compensate RBC loss, fetus starts forming large amount of RBC from bone marrow and liver. The newly formed RBC or formation of RBC is so rapid that precursor of RBC, that is reticulocyte, early normoblast, intermediate normoblast, or early normoblast or even erythroblast appear in circulation of the fetus. This condition is known as erythroblastosis fetalis. In this case, fetus suffers from jaundice. Unconjugated bilirubin level is very high, and this causes staining of this of brain and tissues of brain, because it crosses blood-brain barrier. Blood-brain barrier is not well formed in fetus, and it will enter into brain. It will cause kernicterus. When it stains basal ganglion, it will cause kernicterus. And third is Hydrops fetalis. During third pregnancy or fourth pregnancy, see, again during third delivery, there is mixing of feto-maternal blood, and that causes more anti-D formation in mother. A huge amount of anti-D is very large amount of anti-D is formed in fetal maternal blood, and when it enters into fetal circulation, it causes massive destruction of RBC. The massive destruction of RBC causes rapid formation of RBC from bone marrow and liver, then early erythrocytes, stages of erythropoiesis, that is erythroblast, early normoblast, intermediate normoblast, late normoblast, and reticulocytes are present in the fetal circulation. And in addition to that, liver is forming so rapidly, RBC so rapidly, that it fails to synthesize adequate amount of proteins. This leads to hypoproteinemia, and hypoproteinemia causes retention of fluid in the body. Fluid appears in the interstitial tissues and cavities, for example, pleural cavity, peritoneal cavity, and pericardial cavities. All cavities are filled with fluid, and this will lead to increase in size of the fetus. Fluid also accumulates in the scalp, making head very large, and all these things causes large fetus. And to compensate for that, placenta also increases. There is placentomegaly. Placenta is also increases to supply blood to the fetus, and heart works hard to maintain perfusion of the tissues, and ultimately heart fails. All these things lead to fetal death during pregnancy, in uterus, or when delivered. Vaginal delivery becomes very hard as the size of the fetus is very large, and even if it is delivered, then fetus will die almost immediately after delivery. This is about hemolytic diseases of the newborn. 3 stages that depends upon the severity of antibody formation in mother. First is congenital anemia of newborn, then erythroblastosis fetalis, and last is Hydrops fetalis. That is very serious condition and not compatible with life. Thank you very much for watching. Please share, recommend, like this video, and subscribe this channel. Thank you very much.